All right. So a lot of patients ask me how they can measure their stress levels, um, like an overall assessment. Sometimes people will be like, well, should I do that 4-point cortisol, or should I do blood cortisol, or saliva? Those are useful tests, but sometimes we just want a real quick assessment what your stress levels are doing right now, like today. So I'll do what's called the Koenisburg test, and it's really simple, and it's done in office in our lab, and it's a urine test, and you don't need a lot. Technically, you just need 10 drops of urine. You're adding a couple chemicals, and it's a reagent test. So I'm literally adding drops to see how many drops it takes for there to be a color change. And depending on how many drops are required, usually, obviously, the urine mostly is a clear to yellow. It'll turn a deep red, and it's almost like a instantaneous, like it's very clear that at what point does it change color. Depending on the number of drops it takes, it puts you in one of three categories. So there's a normal amount of, it's actually measuring chloride ion as a kind of an indicator of adrenal stress hormone output. It is also relevant for assessing blood pressure, in a sense of like an aldosterone type of, if there's something over-functioning or under-functioning. Some people come in, they're a little lightheaded, or they get winded walking up and down the stairs, or they see stars when they bend over to tie their shoe. Those are people who usually have low blood pressure. And there's a strong correlation, obviously, with low blood pressure and low adrenal function. I digress. So what we do is we're measuring how many drops. If the normal range is about 17 to 25 drops of the reagent. And if you have a color change in that range, it's considered normal stress hormone function or output. If you have less than 17, down to 0, or it should be 1 really, between 1 and 16 drops of the reagent to make a color change, you're considered in a hyperadrenal state, meaning your body's producing higher than average adrenal stress hormones, which is normal for short periods of time. So you want your body to increase its output of stress hormones, because if you have a stressful day, you're working hard, you're very busy, your body will feel that it has a higher demand on its stress resources, and therefore you have to produce more. And that's fine in the short term. If that problem, call it problem, it's actually a proper function, but if the proper function is maintained or sustained for too long of a period where your body is sensing an elevated demand on your own resources, what happens is that the adrenal gland starts to fail or fall behind. Literally like a factory running out of a resource, you have a bottleneck where you can't keep up with the production of stress hormones. And therefore, these are individuals that when they do the reagent Koenisburg test, they start going to 25, 26, 27, 30, 40, 50 drops before there's a color change. Sometimes in extreme cases, there is no color change, or it takes an excessive amount because now it's not even a valid assessment because you've added too much reagent. And there is no chloride or stress hormone production actively being performed because your body's run out of its resources. And so these are people considered an exhaustion. So the concept or statement that people say, like, well, I'm in adrenal fatigue, is kind of a good way of looking at it. I call it adrenal exhaustion in a lot of cases. And it is a repairable state for the most part, because people can go through periods of adrenal hyperfunction, underfunction, normal function, and everywhere in between. The idea is that you would like to know where you are currently so that you can, recognize some of the symptoms and know how to address it and correct for it. Symptoms of hyperadrenal state is like restlessness, difficulty falling asleep even though you are exhausted, increased anxiety, anxiousness, almost like everything's kind of moving too fast, the inability to relax or know how to like chill out, sit down, slow things down, This is an indicator that the adrenaline or the adrenal function is increased and your body's trying to compensate for it. And it's like, I just can't, I'm tired, I'm burnt out, but I've got this energy and I can't, like, maybe if I work out, maybe if I have a really, really long day, I'll kind of crash in the evening, but otherwise I feel a little bit wired. Contrasting with someone who's underfunctioning or an adrenal exhaustion, they have very low motivation. They feel very, very sluggish. And often this is when people come in for the first time to the clinic because they have an increased symptom picture. I tend to correlate reduced adrenal function with an increase in symptoms. And the idea is that if you have a strong adrenal function, it acts like a buffer or like a protective layer, and it keeps your organs functioning properly during increased periods of stress. But when you have the exhausted state and your body's underproducing stress hormones, you are now susceptible to those increases in symptomology. Your weak spots become more pronounced and more visible. And that's what usually draws people to come into the clinic and be like, okay, I have these symptoms. How do I fix it? So we usually address both the specific symptoms, but also the stress response. So one of the formulas I like to use during periods of adrenal collapse is like an ADR or a strong tonic adrenal formula. Contrasting with those who are in the hyper state, I usually use an adrenal nervine, which has a combination of both tonifying herbs, but also sedating or relaxing herbs, so that, in the mornings you have a nice boost of adrenaline, cortisol, and motivation. But when you repeat the formula in the evening, you have it bookends the day so that you can kind of relax, slow things down, and actually have a more restorative sleep. So this is sort of the Coles Notes version of stress testing in office with the Koenisburg test, and why I think it's really useful as a good indicator of where you are right now and how to appropriately address it and correct for it. All right, thanks.